I guess this is day 0, and this is video 1 of the journey bio, I guess. Today has been highly anticipated for over a year, well, a year almost to the day, and here we are at Mayo Clinic. I'm sitting outside this beautiful area here while Dad takes a nap. His transplant was supposed to be at 9 this morning, but it has been pushed back to around lunchtime, so he needed a nap. He's not doing great. He's having a rough day. A lot of nausea, I imagine a little pain, and some anxiety, I'm sure, but he is doing okay and taking a nap. So for me, as a caretaker, a daughter, a family member, somebody who's been with him in this process for the last year, I'm feeling a roller coaster of emotions today. It's been happiness, sadness, anxiety, scared. I've experienced a lot of fear and relief. I mean, really a lot of relief, because we didn't know if we were going to get to this day. There was more than one time where he was pretty close to not making it, especially like in November. But he's ready, and we're ready, and I don't know, I suppose I should be checking in after everything goes down today, but I figured I better get some of this stuff off my chest. And honestly, there's not a lot out there publicly for family members and caretakers and even patients in regard to the kind of transplant that my dad is undergoing today. It's called an allo transplant, and wow, man, guys, technology has come so far. It's really a very anticlimactic event. Yesterday, the donor cells from a 21-year-old male donor were collected, and about 2 weeks prior to that, he was given some injections to help stimulate his stem cells, and then yesterday they extracted them via the blood, and they go through a process where they spin, like in plasma donation, they spin out the stem cells. And once that's done, within 24 hours, they have to be implanted into the host body, the host being my dad in this case. And so he will have that done. It'll be about a 30-minute to 60-minute process, and then the waiting begins. Over the last week, he's been receiving a series of 2 different chemos to kill off his immune system. So when the donor cells are implanted today, or transfused today, his body, hopefully the chemos have killed off all of the cancerous cells, and the new bone marrow stem cells, healthy ones, will attach to my dad's clean bone marrow, and they will ideally start producing healthy cells that will hit the bloodstream and flow through his body. The 2 main risks are infection and graft versus host. In this case, it's not the typical graft versus host that some people think of. When they think of graft versus host, they think that the host body rejects the donor cells, but in this case, it's actually the opposite. The donor cells recognize that they're in a foreign environment, and they attack the host body. So those are the 2 main concerns, and really it's about a 5-year wait before that's not a concern anymore. However, that being said, the next 100 to 120 days are going to be crucial from a monitoring perspective. He will have 24/7 care that will be provided by the hospital for about 3 weeks, and then by myself, my aunt, and my nephew, and my mother. Thankfully, we have family members stepping in and to really help us get through this process. So for now, it is extremely hot out here. It's extremely muggy. It's only 90 degrees, but it feels like 110. So I'm going to go inside and cool off, and maybe come back out here and listen to this beautiful waterfall here that we've got, and just think for a little bit before all this closed down in about an hour. So if you have any questions or comments, or you need a little boost yourself, I'm always here for a good talk or a good shoulder. I appreciate you, and thank you for watching. Any comments? Leave them below. Have a great day. This is Ricky signing out on day 0.